Good afternoon, Dr. Trinh. How are you today?
I'm great. Thank you so much, Edna. How are you?
Good, good. We're so happy to have you here today. And today, we'd like to hear who you are, what you're involved in, and then we'd like to ask you about exercise and strategies to help, especially during this COVID crisis, where people are not able to get out and do exercises. So thank you for being with us.
Definitely, definitely. So, my name is Young Trin. I'm a board certified internal medicine specialist. I have been taking care of patients for around 20 years now. And and yes, you are right. During this COVID pandemic, we are all, and not just we, pretty much globally, most of us are stuck at home because everything's closed down from schools to movie theaters to a lot of public venues. And as a result of that, many of us are sitting at home and trying to social distance ourselves from the refrigerator, but it's really hard. And and so exercise has been kind of missing in all of this. And the reason I want to bring up this topic of exercise is because it plays a huge role with our overall health. We know that exercise will lower the risk for Alzheimer's by at least 30% based on the clinical research. We know that exercise on a consistent basis will lower blood pressure, and that's been published recently. Those who walk for 30 minutes at least every other day will lower their blood pressure by a few points, systolic and diastolic. And so those are, and although I say a few points, and it doesn't sound huge, but a few points lower in systolic and diastolic blood pressure will significantly decrease the risk for heart disease. It will significantly decrease the risk for stroke. And so it plays a huge difference. And when I talk about exercise, I'm not necessarily talking about long distance running or bicycling or jogging. I'm talking about things you can do at home. I'm talking about things that you can do, maybe with a stationary bike. I'm talking about a brisk walk. And so there are different types of exercises that we can all do even during the pandemic that will make a difference in our overall health, because we don't need to come out of a COVID crisis alive and yet die from a heart attack and stroke because we've been cooped up at home and getting chubbier and not exercising, right? Because that
Yeah.
doesn't make any sense. And that is what we are at risk for, because we're all at home. And I would love to, when we have a chance, to have a longer topic and discussion on this, and show the research as well.
I hear a lot of people talking about, they're not able to go to the gym and they're not able to do the exercise and our beaches were closed, that it's caused significant um, uh, emotions and stress and sadness. Can you address that a little bit?
Yes, yes. And the reason it is causing that is because exercise plays a role in mental health
Mhm.
and emotional health. We know that exercise plays a role with relieving anxiety. We know exercise plays a role with stress
Mhm.
and helping with stress. Exercise, when you're exercising, helps to release endorphins.
Mhm.
Endorphins are these hormones that help you feel better. And so exercise is very connected, not just to physical health, but also to emotional health. And therefore, when you are not exercising, the risk of depression sets in, and anxiety and stress and everything else.
And what do you suggest that they people do that are having these issues in regards to not being able to get out to the gym and do their exercise? What would you suggest as something that they could do at home?
I suggest that folks can still get out and walk
Mhm.
As long as you respect social distancing, right? That 6 feet rule,
Mhm.
you can still get out and walk in your neighborhood. There's nothing wrong with that, right?
Mhm.
As long as you're not in big crowds, there's nothing wrong with walking up and down your block. And I suggest doing that at least half an hour a day. If you can't do it for half an hour at once because your back hurts or your knee hurts, break it down to 15 minutes twice a day, or 10 minutes 3 times a day. If it adds up to a half an hour a day, several times a week, that's a good thing in reducing all these other health factors that are associated with the lack of exercise.
Well, thank you, Dr. Trinh. We at Healthcare Christian Fellowship look forward to further lectures from you and longer lectures to help us understand all of these issues related to strategies for exercise and so on. Thank you so much, and you have a wonderful day, and God bless you.